Madam Chair, members of the committee, I am Rob Sisk, president of SEIU 503 OPEU, and I'm also speaking on behalf of sister local SEIU 49. Together we represent over 65,000 workers and their families throughout Oregon, with thousands of our members employed in the healthcare field. Not only are these thousands of members directly impacted by the struggles and frustrations of trying to provide care and services within an inefficient system, but over half our members are low income, having to suffer the costs and tenuous outcomes of an unreliable but exorbitantly expensive system. For many years, SEIU, both on the national and the state level, has been advocating for affordable, quality health care for all. Our work has been guided by the conviction that regular access to health care is not just a privilege for those who can comfortably afford it, but a right for all. If access is limited, the economically disadvantaged, so desperately needing both the physical care and the moral support, are not only ignored, but their health issues dangerously worsen, which drives up the cost of health care for all, since neglected conditions require more intensive and prolonged treatment than if they are addressed at earlier stages. SEIU, on a national and state level, has also championed health care that will rein in escalating costs for both public subsidized and privately paid health care. We support strategies and operations and outcomes that put Oregonians first as consumers and taxpayers by creating the most cost-efficient system with the best possible results. Tragically, for what should be a humanitarian-driven system, healthcare services continue to be exploited by those using it for their own financial interests, the pharmaceutical industry, the insurance industry, and unfortunately, often by what should be the paragon of healthcare in its most recognizable face, the hospital industry. Executive compensation and profits in all these industries are outrageously high and even immorally high, as these industries have spent nearly $3 billion in the last 15 years lobbying for more tax breaks, tax loopholes, exemptions, protections, and other special privileges, enabling monopolies on high-cost drugs and procedures, excessive fees, and other profit drivers. As a result, health care costs continue to escalate, so even those with insurance plans are left with high premiums, copays, and deductibles. Yet quality and access remains low for many Americans, and not uncommonly with substandard results. A study less than a year ago published in Forbes showed the United States dead last behind 10 other major developed countries in overall health care and in the categories listed. It was second to last in access, last in efficiency, last in equity, and far and away highest in cost. Dr. Russell Andrews, a neurosurgeon and author of the book Too Big to Succeed, a stark revelation of how America is on an unsustainable healthcare course, laments the morphing of American medicine from a function of a humanitarian society into a revenue stream for healthcare profits, drug and medical device companies, hospitals, and insurance companies. In essence, he says, we have transformed healthcare in the U.S. into an industry whose goal is to be profitable. Dr. Andrews goes on to characterize the profit motive as a virus infecting the healthcare system. Even with the Affordable Care Act, the low-income and the no-income struggle simply can't pay the costs that are left them. Despite the intentions of HCAO, those on the edge who are falling off do not have full access to care, or their care is limited. Insurance companies have found ways to get around the act by minimizing plans and still pushing expenses on to the insured in order to ensure their high profits. 5 of the largest healthcare insurers in America made a combined profit of nearly $18 billion in 2014. Dr. Sakin Shah with Doctors for America states that for insurance companies, their business model is to profit by finding ways to avoid caring for sick people in their time of greatest need. Drug costs continue to be high for many who have no other alternative. Pharmaceutical companies have long since moved from simply making profits to profiteering at the expense of those in dire need of medicine for survival. The top 10 drug companies in the world made a combined profit of $83.33 billion in 2013. In the interest of profits, a majority of hospitals avoid transparency on service costs and outcomes. Hospitals enjoying tax-exempt status as nonprofits avoid the obligation of charity care that should go with that status. Again, in the interest of profits, in what should be a model of humanitarian service, costs are as excessive as is executive compensation. Meanwhile, healthcare spending is about 17% of the national economy, or about $3 trillion a year, and is projected to reach 20% of the GDP by 2021. In Oregon, it is significantly more, around $9 billion, or about 22% of our state budget. The necessity for care against the costs escalating nonstop means other parts of our economy and other vital public services are alarmingly underfunded or neglected. Our objective should be obvious. Take the obsession for profit out of healthcare and you put the care back into healthcare. The primary motivation should be to keep Americans healthy and to return Americans to the best health possible as quickly as possible. When we accomplish that, we will profit in so many other ways as well. SEIU is here today because it supports legislation for the system that will do that best. Thank you.